Good afternoon. I thank the AIOC and the Managing Committee and Dr. Sandra for giving me this opportunity. I'll be just sharing our experience of screening a million school children. So this was by Level Fund, supported by Level Fund, and it was done at Tirunelveli and Pondicherry between 2010 and 13. So the main purpose of this project was to address the problem of visual impairment and blindness in school children among 0 to 17 years in the service area of Tirunelveli and Pondi, and to create awareness about the pediatric eye problems, as well as to develop a model for the service delivery. So we wanted to develop a strong referral system in the community, and these were the activities and targets which were fixed, and the expected outcomes. What we wanted to achieve was to strengthen our pediatric ophthalmology clinic at the base hospital, and to increase the patients coming to seeking healthcare. So the healthcare behavior also will improve, and increase the awareness level among the different stakeholders and the access. So we wanted to develop a scalable model, and this was the budget that was given, and this is the service area and the target population. Arvind Eye Hospital Tirunelveli, which will cover the 3 districts of Tirunelveli, Kanyakumari and Thoothukudi with a population of 59 lakhs, and Pondicherry, Kadalur and Viluppuram. So 2 extreme southernmost tip of India and the other on the northernmost tip of Tamil Nadu were covered. And these were the strategies: awareness creation, a knowledge aptitude study, and the development of the IEC materials, making seminars and conferences, and then screening in different age groups, starting from the newborn babies to the preschool children and the school students. And capacity building, of course, infrastructure, human resources, systems and processes to be kept in place, and finally the service delivery, hospital based or this thing. So this was the strategies, and we developed all the IEC materials and the awareness lectures for teachers, students and ICD staff. So the main thing is we got all the headmasters in. So for school screening, we call all the headmasters, and we gave an awareness talk to the headmasters, and we gave a free screening for them, and finished with a lunch session. So that brought everybody in. Like when we went in for when the organizer went for the school screening date and all that, it made our things job easy, because they had come here, they had seen this thing, we gave the lecture to them. It helped us build us confidence about it. So these were the accomplishments. Like we had screened 1,04,547 children, and 23,942 glasses were given, and 953 cataract surgeries were done, as you can see here. And 0 to 5 was also covered, around 1,15,460 0 to 5. So there was a learning in this also in ICDS, as Vijay Madam first initially was pointing out that you may not get lot of cases. Yes, we didn't get lot of refractive errors or something, but we got one or few cataracts we could pick up, and few squints we could pick up, but not much of refractive errors in this age group. That is why they also have this, government also has this Kannoli Thittam from 6th standard to 10th standard. That's why they are also running, and we all know myopia starts by 9 to 10 years of age. So the other thing which we built on was the ROP screening. We really strengthened the preterm ROP screening, especially Pondicherry, which was not having a program existing at that time, and they strengthened it. And now at Tirunelveli, we are seeing 3,300 in the OPD, and 4,173 through teleophthalmology, which is a huge number, and we are able to prevent so many children from going blind. And as we all know that it will really prevent lot of people going into lot of trouble, because it becomes very difficult to bring up a blind child. So these are some of our photos where we went to the ICDS centers. The thing is, we mapped the ICDS centers. So all of you know that ICDS has only around 15 children in the center. So we mapped the areas, and in a single day we will go to 8 to 10 centers, and so that we can cover more children. And the regular school teachers training program. I won't show the video because all of all of us, most of us know here. And we had exhibitions in the hospital, and we were celebrating the 25th year of Arvind Tirunelveli, so we had a huge exhibitions and lot of competitions, everything, to create awareness for the children, for the parents and these children. So the school screening factors that helped us was because of the support given by the school management, the teachers, the district educational officers whom we had met, and the ICDS. We went and met them, the Sarva Shiksha Abhiyan and ICDS block officer. They were all very supportive, and we created a rapport also with the general physician, pediatrician, the general ophthalmologist, which helped in increasing the referral to the base hospital. And Sarva Shiksha Abhiyan of Pondicherry came forward to support the school screening and cataract surgery. And there was very good cooperation between the hospital, the project staff and the camp team. And daily almost 2 camps used to be really wet in for 2 school camps a day. So these were some of the challenges because of the government school screening program. In the first year, we couldn't get the permission to screen the children in Kanyakumari and Kadalur district. And so we utilized the private management schools and the primary schools and achieved the targets. And some schools were not willing to spare the teachers out to be trained in vision screening, fearing that it may affect the academic work. So what we did, we trained the field coordinators and some of our counselors to go and train them there itself, and we gave the charts there and came. And the poor compliance was there, and we are still trying to work on the improving the compliance. And the one thing that which helped was doing the training, screening by the class teachers training model, which I will show you now. So we learned that one of the other lessons we learned that was the respective class teacher is more effective than screening of all children by a few selected teachers. Previously, they used to send only the arts teacher or the sports teacher for the training for the training program. So only 4 teachers will come for 2,000 children. So instead of that, we trained the class teachers of all the classes so that they just have to screen only 40 children, and it was a more effective screening, and there was more bonding between the class teacher and the children, and they made sure that follow-up also improved and the compliance also improved. So this another thing we learned was we helped us to understand the prevalence of refractive error in the 0 to 5 age group, and the community participation is very vital for any program, and it helped us to unearth our own capacity. From 30,000 we were able to screen up to 2 lakhs per year. So this was the project impact. We created awareness among the school staff, ICDS, and now they ask for the come and conduct the school camp in their school. So to that level we have grown up. And the increase in the pediatric outpatients, now we are seeing an average 160 to 170 patients per day at our hospital. So these were some of the publications which got published by Arvind Pondi, the all class teachers model in epidemiology. And we had a publication about the non-compliance for wearing spectacles and what are the prevalence and determinants. These are some of the publications. We have to come up with more. Thank you. Thank you for a patient hearing.